If you're working in the NHS but you did not have your training in UK, I'm here to tell you to dare to dream. Dare to dream. So when I say dare to dream, I know exactly what I'm talking about because I come from a background that is similar and possibly the same to most of you watching me today. And back home, in a typical ward, you're either the matron, the nurse, the doctor, or the pharmacist. There aren't many opportunities for you to explore. If you are the nurse, then you're looking to become a matron one day, and if one day the matron position becomes vacant, you're competing with about 6 or 7 people, and the position usually goes to who has been in the ward the longest. Okay, the situation is different when you come to the UK. There are many nursing career opportunities for you to explore, but what happens? We become complacent because, to be honest, we are happy being band 5s with better working condition and a better pay compared to where we were. What if I told you there are career opportunities that would be more interesting than being a band 5, that you can still even get better pay and you'll not be worried about all those things that you're worrying about now? In today's video, I'm going to be talking about 5 very unusual nursing career paths for you to explore. I'm hoping that at the end of today's video, even if you don't like any of the 5 that I'm going to mention, I would have piqued your interest to start exploring, to start going through your trust job sites to see what else you can do other than being a band 5 nurse in your ward. Number 1, become an alcohol nurse. Mind you, I'm not saying alcoholic nurse. That's different. Become an alcohol nurse. Alcohol nursing is actually a thing. Yes, it's a career path that you can pursue if that is your interest. What will you be doing as an alcohol nurse? You're going to be caring and treating patients who have misuse issues with alcohol. So this could be addicts or people struggling to quit and all that. Now let's look at what qualifications you will require to be able to practice as an alcohol nurse. First and foremost, you must have a valid and active NMC registration. You cannot become an alcohol nurse. You cannot become an alcohol nurse without a valid and active NMC registration. Another requirement that you need is to have some form of a teaching module or mentorship. So if you haven't done that within your trust, consider doing it. Okay, the next thing they want you to have is a degree. So if you don't have a degree yet, consider getting your degree first before looking into this particular post. They want you to have at least a degree. The next qualification is for you to have post-registration qualification. So after you became a nurse, have you done modules? Have you gone ahead to enroll yourself in certain modules, or have you just been practicing? If that's one thing I know about the UK, is that even after you've qualified, they want you to do trainings. They want you to keep updating your knowledge, keep enrolling yourself in modules and courses. Okay, they want to see some form of post-registration qualification. And lastly, your willingness to undertake certain courses once you get the role. So for instance, maybe the qualifications that you have is not relevant to the role per se. Once they pick you to become an alcohol nurse, you must be willing to undertake courses that will be relevant to your role so that you can be a competent alcohol nurse. Once you are employed in this role as an alcohol nurse, you are going to be earning over 35,000 to over 42,000 per annum. So is this something you'd want to do or not? You can also become a cruise ship nurse, going on cruises in big and huge ships across oceans, across the sea. This one, I feel like it will be like a vacation, because being on a cruise ship, oh my god, it must be fun. I know it will be fun to be this kind of a nurse. So if you are a cruise ship nurse, here are the responsibilities that you're going to be dealing with. Number 1, you're going to be providing care to people on the ship. Okay, there may be emergency while people are on the ship enjoying themselves, so you are going to be the nurse that is going to be there to provide care for them. Also, there are going to be doctors as well. So for instance, if a doctor on a ship prescribes certain medication to people that fall sick on the ship, you're going to be the person to administer those medications. So because of that, here are the qualifications that you must have to qualify. Number 1, at least you must have a basic education up to degree level. Yes, there's a minimum degree level. Okay, number 2, your NMC registration must be active. You must have active license to practice as a nurse Number 3 is that you must be skilled in basic life support. Emergency, remember, someone may be choking and you must be able to act and save the person's life. So be skilled in BLS or PALS, that is pediatric advanced life support, so for children and for adults as well. And how much is your salary going to be as a cruise ship nurse? Well, for the job that I saw, it was £5,417 per month. Yeah, so it's good pay. So if you are someone that enjoys the sea, going on cruises, this is something that you can also look into. The third career path is to become a flight nurse. So if you're someone that loves planes, you love helicopter, you love being in the air, with this one you can actually work for the Air Force. Okay, you can work for the Air Force if you decide to go with this career path. So what will you be doing as a flight nurse? As a flight nurse, you are going to be providing a comprehensive pre-hospital emergency and critical care to your patients. So because of that, here are the qualifications that you need. You must be licensed to practice, active license to practice. Number 2 is that you must have at least 2 years experience in critical care or accident and emergency, okay, before you are considered for this role. So it's not for everybody. Number 3 is that you must be skilled in BLS and PALS as usual. Okay. Number 4 is that you must have at least a Bachelor of Science degree. So these are the qualifications. But the pay is good. The pay is good because you are going to be earning over £6,000 a month. So is this something you want to do or not? Number 4 is to become a quality improvement or quality assurance nurse, and this is more of corporate nursing, and I personally know someone who is into this kind of nursing. So with this one, your duty will be to examine and evaluate the quality of care that is being given to patients and to make sure that it is of the highest quality and that it has met established standards. So for instance, you'll be going from ward to ward, making sure that the systems are in place, all those things that have to be working are working as they should, to make sure that we are giving the highest quality of care to our patients. So yes, this is another one that you can consider doing. If you don't want to become a bedside nurse or remain a bedside nurse, you can consider doing this one as well. It's more corporate rather than clinical. Now let's look at the qualifications that you need for this particular role. So like the others, you must be a registered nurse, have active NMC registration, you must have some form of post-registration training, and also you must have a teaching module. So you must have done a teaching module as well. You are going to be earning over £43,000 to about £50,000 per annum. Is it good or not? And would you like to consider this post? Right. Last but not the least is a remote monitoring clinician. So let me tell you that over here, some patients do not want to go into the hospital. They want to stay in the comfort of their home and receive care. So now the NHS has introduced virtual nursing to make that possible. Okay, for patients who do not want to go into the hospital, they can stay in their home. What usually happens is that they have a device that they wear around their arm that sends reading to you, a remote monitoring clinician, who will be in an office or at home. Okay, so you are the one who is going to be coordinating care for this patient. You're going to be monitoring this patient's observations through that device. If you see that anything is out of the ordinary, then you can speak with a doctor, or you can escalate it by ringing an ambulance for the patient to go into the hospital. Some patients want to go into the hospital only if necessary, but others will still want to remain in the comfort of their home until they pass away. So this is going to be your role as a remote monitoring clinician, coordinating care, making sure that the patient has the best quality of care that they can while living in the comfort of their home. Okay, and what qualifications do you need to become a remote monitoring clinician? All of the ones that I mentioned before: degree, some form of teaching qualification, post-registration qualification, but in addition, you must know at least the basics of the computer. Okay, basic system 1 and all those ones, you will be using that a lot, so you must be computer or tech savvy as well. And how much are you going to be earning in this role? So you are going to be earning anywhere over £35,000 to about over £42,000. Okay, so this is a good role for you to consider if you're someone that loves virtual nursing, or you want to move away from patient side, then consider virtual nursing. Right, so these are the 5 unusual nursing career paths that you should consider going into. Okay, if you want to move away from bedside nursing, I wouldn't advise starting in these roles. So I'm not saying bedside nursing is not important. Bedside nursing is very important, but don't stay there. Do at least 2 years of bedside nursing and explore your other options. Okay, don't stay there for many years. Once in a while, when you're there, go to your hospital's job site and scroll through the job alerts that they've put there. Go through the qualifications that is needed and then work towards it. If you get something that you fancy or something that piques your interest, work towards it. Thank you very much for watching this video. I hope I've motivated you enough to start to research into a field that you would love to explore. If you've gained knowledge from this video but you're not subscribed to my channel, click below to subscribe and join my Telegram pages for nurses and teachers as well. And I'll see you in my next video.